Hi, I'm Dr. Kadur. I'm a palliative care and wound care doctor. Let's talk about doing a dressing change. Most of the chronic wounds just need a dressing change. There are certain circumstances that you have to go to a doctor, which I will discuss at the end of this presentation. Otherwise, most of the time, what the wound needs is just a dressing change. So you don't have to uh, be a medical person or a trained expert to do your own dressing change. Let's see, is it difficult? If you are accustomed, if you have a small idea, and if you have the correct dressings and stuff, it's not difficult at all. It's a piece of cake. And do you have to go and wait in a clinic queue for a dressing change? It's just a waste of time because a routine dressing change, you don't have to go to a clinic. You just remove the dressing and put it on. That's what they would do in the clinic. So uh, you going wasting your time, wasting your petrol, wasting a lot of money for just a change of a dressing, just a waste. So what I advise is for you to uh, train yourself to do a routine dressing change. So before going into how to do it, let's have a brief idea about what are the parts of a dressing. There is the primary dressing, which goes onto the wound, which touches the wound, which has the medicine or uh, whatever the corrective method of this problem of the chronicity or problem of the wound. So once that is known, you just have to carry on the dressing changes until the wound heals. So that this is the primary dressing is the one that will address the main issue of the wound, and it has to be sterile or really clean. So the secondary dressing is for the protection of the primary dressing to keep it on top of the wound and prevent pathogens from entering from outside. And there'll be a tertiary dressing in some chronic wounds. We use the tertiary dressing to apply pressure into venous ulcers and to offload some foot wounds. That sort of thing can happen with the tertiary dressing. But all these things can be done at home when you train yourself. What do we need for dressing change? You actually need soap and water to clean your hands, and hand sanitizer is available, clean gloves, and of course the primary dressing. And to make the secondary and tertiary dressings, you need clean gauze and some bit of sterile gauze as well. Sometimes plaster of adequate sizes and bandage, of course, not the regular gauze bandage. It should be elastic cotton crepe bandage. At all times, try to avoid these cloth-like cotton bandages. You should always put, if you are putting a bandage, you should always put a cotton crepe bandage. And sterile scissors and forceps are not mandatory. You can clean your gloves with hand sanitizer and use. If they are available, of course. And how to prepare? First, of course, you have to wash your hands with soap and water and dry them and sanitize with hand sanitizer. And put on the clean gloves and open the packages with sterile gauze and instruments if they're available, and whatever the clean gauze packets and dressing materials, especially the primer dressing and all that, you have to lay it open and put it in a way that you can access it very easily during the procedure. And then remove the existing dressing and throw away the gloves and put on new ones, and then you are ready. And another thing that I have to tell you all is that this wound dressing change procedure will create clinical waste. So clinical waste should be discarded properly. And they read properly. There are advices in the internet how to bury them, and or else you can just burn them. It's not plastic. Most are not plastic, so it should be okay. And the process, I have recorded myself doing a small dressing. This was a toe injury, big toe injury, an accidental one, and ultimately leading to some bone infection. And somebody has done a done a removal of dead bone, infected bone, and the patient came to me. Uh, for about 6 weeks, it was not healing. Now it's granulated and filled up. So it's a simple wound now. We are really going to do a 2-layer simple dressing on it. So you can watch the video and appreciate what I have said.
Last. Okay. When? Cover passed ना? How to?
You must have noted during the video, I used a non-touch technique. I didn't touch the side which goes into the wound, whatever the dressings. And I was using instruments, of course, sterilized instruments. If you don't have them, you can just try it with your gloves and try not to touch what goes into the wound, what touches the wound surface. That's called the non-touch technique. And of course, when to see a doctor, when you are dressing the wound, you might encounter these problems like infection, warmth, redness, and there's some pus. That sort of a scenario, you must immediately see the doctor. If you notice blackish dead tissue, you have to see the doctor. And of course, there's pus. You have to milk from the periphery of the wound before dressing it. Try milking it from the periphery and see whether pus is coming out or whether pus is coming out from the wound. And you have to notice whether you have to appreciate whether the wound is increasing in size. Then you have to immediately go to the doctor because whatever you are doing is not working. And if there's increasing odor, increasing pain, you have to see the doctor. And when you are trying several dressing changes, if the wound is not progressing, it is not seems not healing. If the wound is as it is when you open it after says in several attempts, you should see the doctor. That's all. And it's an easy thing, and it will save you a lot of time and a lot of money as well. Thank you very much.